Regular health care is critical for a child to grow up to be a strong and healthy adult. We all know that. Yet every day, millions of American children are denied access to this very basic need. They can't get regular checkups or see a family doctor for sore throats or earaches or fevers. And so as our economy continues to struggle, this problem is growing worse. At the end of 2007, all of us came together on a bipartisan bill that would have taken big steps towards helping millions more kids get health care. It would have renewed the Children's Health Insurance Program and made sure that almost 10 million low-income children would be covered. It is a tragedy and a shame that children's health care became the victim of a partisan fight. But this week now, we have the opportunity to make children's health a priority by renewing and expanding the Children's Health Insurance Program and getting it signed into law. And it could not come at a moment too soon. In the years since former President Bush last vetoed CHIP, unemployment has skyrocketed nationally and in my home state of Washington. And as a result, millions of families across our country have lost their health care in just this last year alone. Madam President, that's wrong. And it's one of the reasons that we have now put CHIP at the top of our agenda this year. In difficult times like this, it's more important than ever that we make sure that our nation's children have a place to go where they can get medical care. So I am here today to urge all of my colleagues to support the 2009 CHIP reauthorization. It is the smart thing to do for our economy. It's the moral thing to do for our children. Madam President, most of us here in the Senate support reauthorizing and improving the Children's Health Insurance Program because we share the goal of ensuring that all of our kids can get health care. Study after study has shown the benefits. Children in this program are much more likely to have regular doctor and dental care. The health care that they do receive is better quality, and they do better in school because they are healthy. Madam President, this bill is almost identical to the one that we passed overwhelmingly in 2007. It ensures that the children already enrolled in CHIP will continue to receive health care, and it provides another 3.9 million low-income children with coverage. Most of those are kids who never had insurance because their parents couldn't afford it, who lost Medicaid coverage, or who were recently dropped from private insurance rolls. And I think it is critical that we expand health insurance to make sure that they are covered. Now, there are a couple of specific provisions from this bill that I want to highlight to make sure that everyone understands why it's so important to pass this bill now. First, Madam President, as I said at the beginning of my remarks today, the economic recession has made it even more critical that we make children's health care a top priority and reauthorize this CHIP program. Just on Monday of this week, some of the strongest companies in our nation announced that they would cut 75,000 jobs combined. Unemployment is now at the highest level in 16 years, and we are being told that we haven't seen the worst of it yet. The Kaiser Family Foundation estimates that every time the unemployment rate increases a point, 700,000 more children lose their health insurance. By those numbers, well over 1 million more children have lost their insurance in the last year alone, and many more will lose their coverage in the weeks and months to come. This bill makes it easier for our states to ensure that those children will continue at least to get health care. It adds more flexibility to the program and sets funding rates based on state budget projections. So our states that are in the worst financial shape will get more money to help pay for health care. This would be a huge help for my home state of Washington and for the many families who are struggling to provide health care for their children. At the same time, Madam President, the bill will strengthen CHIP by making sure resources are targeted at covering the low-income, uninsured children Congress meant to help when we created CHIP back in 1997. It gives states new tools to raise awareness about CHIP in rural, minority, and low-income communities to help reduce the disparity in care for minority children and extend care where it's most needed. And it creates a performance-based system that rewards our states for reducing the number of uninsured children by making sure that the lowest income children are the top priority for CHIP and Medicaid. Finally, Madam President, CHIP is paid for. The $32.8 billion cost is covered by a 61-cent per pack tax increase on cigarettes and other tobacco products. We aren't taking away from our other economic priorities. Social Security isn't raided, deficit won't be increased. It is a win-win for everyone because experts estimate that by increasing the cost of cigarettes, almost 2 million adults will quit smoking and then will prevent millions of kids from ever getting hooked. It's good for our children now, and it'll help millions stay healthy in the future as well. Now, Madam President, although this bill does have broad bipartisan support, some of our colleagues on the other side of the aisle have tried to throw up some obstacles that distract us from the real issues. I want to make clear right now what this bill is really about. It is about our kids. This legislation is about making sure that our children can see a doctor when they're sick. It's about making sure that they get medicine that will help make them better. And it's about honoring our promise to provide 10 million kids with health care that will help ensure that they can grow into happy and healthy adults. So I come to the floor this afternoon to share a story about a little girl from my home state because I think it puts the importance of this legislation in perspective. Madam President, meet Brenna. She is 6 years old, bright, happy child, but she has a serious genetic condition called cystic fibrosis. Brenda's family lives in Marysville, Washington, in a part of my state that has been hit tremendously hard by economic downturn. Like a lot of people with cystic fibrosis, Brenda's health care costs are about 10 times more than the average child. And it is nearly impossible for her to get private health insurance to cover the bills that she is facing and her family is facing. In fact, almost half of the children with cystic fibrosis would not have health care at all if they didn't have CHIP or Medicaid. Now, Brenna's mother, Brandy, recently wrote to me to tell me that her family depends on CHIP for Brenna and to keep her family going. And I want to read what she wrote. She said, quote, "I don't know what I would do if I did not have this wonderful program. I simply would not be able to pay for her to receive the care she does now. I would be in never-ending medical debt, and in the end of it all, I would most likely lose my daughter either way. The economy is rough enough right now. The CHIP program is something I'm extremely thankful for. It provides me sanity and strength every year to take care of my child and her needs. Please allow this program to continue. Our lives depend on it," unquote. Now, Madam President, those are heart-wrenching words from a mom. Most of us can't even imagine being in Brandy's shoes. Her daughter's story shows us just how critical this children's health insurance program really is. This bill that's in front of us today is about Brenna and the millions of children just like her around the country. So, Madam President, when it comes down to is this: when a child gets a cut that needs stitches, has a fever or an earache, or develops a serious illness like cystic fibrosis, they should be able to get health care, period. I want to make sure that Brenna's mom never has to worry about her going into debt to keep her own child alive, or whether health care will be there for her daughter. So let me say it again. This bill is about making sure our kids can see a doctor. Passing it is the smartest thing we can do for our economy, but it is also the moral thing to do for our children. So on behalf of 6-year-old Brenna, the 115,960 uninsured children in my home state of Washington, and the almost 9 million uninsured children across the country, I urge all of our colleagues to support this bill.